Can you grab that one? Sorry?
Yeah.
Grab that mic.
So this is really, really terrible. Just to say my name, just my name, I need like a minute and a half. Mauricio González de la Fuente is my name. I'm the CEO and co-founder of KoduCare. And it's really awesome to see so many familiar faces here. So thank you for the invitation. KoduCare is really all about bringing patient success management to mental health. And now everyone is going, oh shoot, I thought this was going to be a fun event. And now we're going to be talking about mental health. Well, I'll try to make it as easy as possible. So this is me. I was a very cute kid, as you can see. The other thing that you can see is that I was already developing some very amazing skills to connect with people. Look at those eyes. I'm already relating to people. Then I became kind of a snotty teenager. I think a little bit too snotty there. By then I have all sorts of coping skills and coping strategies that allow me to navigate the world regardless of how horrendous my childhood may have been, right? And then, of course, this is me. I joined Microsoft in 1992. I was with the company for 22 years. I was lucky to be one of two entrepreneurs in residence sometime in the past. And my last job was general manager for customer lifecycle management. And so, full of promise, very serious, of course, probably as serious as I look today. And then, of course, I also had lots of friends and parties and all that. But suddenly, of course, life happens, and life happens to all of us. And what that means is that we may have perhaps lost a family member, we may have gone and gotten a divorce, lost a job. Life happens to us, and when life happens to us, all of that composure that you see is completely gone, right? Those coping skills that we had are no longer enough, and we need some help. And the reality is that in this room, I would say even more, but according to the NIH, 46.9% of the population will have some sort of mental health diagnosis in their lifetime. So, and in this room, I would say it's more like 98, 97%, around that. But, give or take. So, really, it's a staggering number. Most of us need help, and the reality is that there is not enough being done around mental health. Starting with a stigma. This is the first definition of stigma that I found by Googling the word stigma. And you already see the example, the stigma of mental disorder, as the example for the word. And so that's really where the problems start. But it gets really worse. There are referral paths that exist today in healthcare that are really, really awesome for, you go to your PCP, your primary care physician, and you immediately get connected with labs, with imaging, with specialists. But when you want to go see a therapist, or when your PCP suggests that you need to go see a therapist, what you get is a printed piece of paper with some name circled. And so those referral paths are not there, and people are not getting the care that they deserve. It's also a very fragmented field. In the Puget Sound area, there are 5,500 therapists, all practicing all sorts of different modalities, and few of them are evidence-based. And the final challenge is that there is very limited integrated care. Yes, you get the health care on one side, but when you actually want to get a full view of the patient, there is no visibility on patient outcomes. So we believe that it's about time that we fix mental health. And so our answer is quite simple. It's actually the bar to have an impact in mental health is quite amazing. So we really start by bringing success management to mental health. Step one. We connect patients, we connect physicians and patients with therapists. So we build these referral paths that today don't exist. We have algorithms and all sorts of methods that allow us to match patients with providers. And then finally, we success manage patient outcomes. And because I only have a few minutes, I only have a few seconds, I just want to tell you that we do this because we're very passionate about mental health. We believe that there is absolutely no health without mental health. Thank you.
Questions? Please grab the microphone too.
Questions?
Mauricio,
Yes, sir.
please grab the microphone.
Do I have questions for you guys? Yes, you, please. No. Any questions?
When is it available?
It's available today, and so happy to talk to you. We don't have it publicly available. We do referrals through PCPs, through providers, but we're happy to entertain your needs. Go to the website. There's a button that you select that says for patients seeking therapy, and we can take care of your needs. Yes, sir, in the back. Yes, you, green. Oh, we make money in multiple ways. Our business model is very simple. If you think about a babushka doll, at the core of our business model, we make money by connecting patients with providers. Providers are looking to bring new clients like anyone else. Every small business wants to find new patients. So we collect a fee for bringing new clients, driving billing, and driving scheduling. So that's a percentage fee that we keep. The second layer of the babushka doll, we make money by doing the case management for large healthcare organizations, and so we do some of that. And then the third component, which is very, very green at this point, it's going to be a component that is important to us in the next 18 months, is really all of the data and all of the analytics that we do across the patient life cycle. Other questions?
One more?
That side, yes?
With all those 5,000 providers, do you evaluate them in any way, or do you just put them in the database?
Actually, no, we don't have 5,000 providers in our network. We have a number of providers in our network. We're very selective with the providers that we work with. We want to focus on providers that are outcomes focused, providers that are able to work in the models that we propose. But no, we don't need to be involved with all 5,000. We have a much smaller number for that to reach capacity. One more question?
Nope.
We're done?
That's it.
Beautiful. Thank you, everyone.
Thank you, Mauricio.